Good morning. Today is May 17, 2020, and this is a Tuesday morning. Today, the weather is really nice, really beautiful, and during the pandemic, not every day the weather is nice. There are times that the air is full of viruses, and when I step into a dirty air, I basically start choking. I can't breathe because my body is extremely sensitive. And if the weather is great like today, I can breathe really smoothly. I feel good. My lung is good. My energy level is good. So not every day is like this. So during the pandemic time, for now, I predict probably gonna go to the beginning of next year. Not just me projecting, but I've been watching YouTube. There are some people predicting the same thing as well, and the virus just will not go away this easily. The fact that you can't even kill it, if they want to go away, they go away, because the virus they will not die. Basically, because I try to, let's say, how the water I think I talked about it before, that the water system has virus in it, and I try to boil the water for 45 minutes, and the virus will not die. And people say that the virus can stay on the surface for a couple of days. I believe that the virus can stay and hide over quite a few months. That's my belief. I'm not sure if I'm correct or not, but we'll see. We'll see. So I want to talk about today, the main thing is what I have been doing at home during all this time. I have not been wasting time. No, at home I've been doing something productive. And one of the productive things is that I have been seeing patients remotely, or a more scientific term is they call it telemedicine. Nowadays, telemedicine, I just read a report yesterday. Telemedicine, the amount of telemedicine is growing ever since the epidemic has grown about 200%. So a lot more doctor, clinic, and hospital is implementing telemedicine. And what is telemedicine? Telemedicine, it is exactly what I just said. A video recording, video conferencing with patients. So what I use WeChat video. I also use Line videos. I use FaceTime occasionally, but the WeChat or the Line system, it seems to be working really well for me in my area, which is the Southern California, San Gabriel Valley area. So, and at the beginning, people weren't really open. They weren't sure, patients weren't sure really how that worked. But at the beginning, of course, I offer free consultation. I basically don't really charge patients for seeing them over the WeChat video or the Line videos. I basically look at them, just like that, and then I talk to them in the video, and then I test them. In the past videos, I have demonstrated on how to do muscle testing, where I demonstrated with my kids, my son and my daughter, whereas they hold their hands up and I push them. And that's a form of a muscle testing or energetic testing to determine what kind of problem you have with your system, whether you have virus, bacterial infection, whether you have toxicity, whether you have organ issue, you have spinal issue, muscular pain. Anyway, so other than doing the muscle testing, there are a self-testing mode that you can actually find it very easily on YouTube. If you go to YouTube and search the manual muscle testing or self muscle testing, you can find out a lot of people that they test without using another people's arm. There's a lot of ways to do self-testing, but I'm not going to show here because I'm not teaching that. You could very easily find on YouTube on the instruction on how to do self-testing. So this is what I did. So I did a self-testing on the video across the patient on the other side of the video. So by me looking at the patient, I can test their body system, whether they have infection, where is the infection, if they have any pain, I can determine what the cause of the pain is. If they have any sort of flu problem, like sore throat, fever, coughing, I can pinpoint, find out where the problem is, what organ has problem, and what kind of infection it is, and then I can find the appropriate supplement or herbs or homeopathic medicine and for them to take. And all they have to do is call my clinic and order through my staff, and my staff will mail the supplement to their house. So I've been doing that for the past 2 months, and it has been doing really well, and patients have seen great results, instantaneous results. I have patients that have sleeping problem, they solved. Shoulder problem is solved. Headache, it's good. Tons of fevers, sore throat, coughing, that's solved as well too. Yeah, you name it. So this really shows, and a lot of people, after they have 1 or 2 sessions, they started to believe, because during those 1 or 2 sessions, or after the session, when they start taking the supplements, they're feeling so much better. So they started to believe it, and they started to come back to do these kind of video session with me more and more. So again, I'm at home doing the video session with them. They could be at their house, or they could go to the clinic. Whereas I have different supplements I can test them with at the same time they're getting the video session going. Okay, so I don't want to make it too long. So this is, one of the things I've been doing while we have been staying in the house during the pandemic. All right, thank you for watching. Again, please press like and subscribe if you want to see more video, and I will be uploading again more video on these medical coronavirus testing things. Thank you for watching.